the wall of the heart. What it consists of? Outermost layer. It is, the heart is located within a sac-like structure. What is this sac? Pericardium. How many layers are there in pericardium? 3 layers. What are these? Fibrous. And just immediately after this, what? Serous. One serous layer. And the name of this serous layer is? One serous layer is there. Parietal. Parietal layer. Okay. Parietal pericardium. And after that, another layer is there, visceral pericardium, covering the myocardium. In between the two serous layer, there is a space. This space is called pericardial cavity, and it contains one fluid, pericardial fluid. What is the type of this fluid, nature of this fluid? Viscous. And it's lubricant. Its action is like lubricant action. Why it is needed? Outer pericardium fibrous layer is fixed. It cannot be, it is non-elastic. Okay. So heart is sometimes contracting, sometimes relaxing. Not only this, moving like this. So it may cause friction, and friction may cause damage. So that's why if one lubricant lies in between, then there will not be friction between the two layers. The fluid will take it will prevent this friction. So that's why it is needed. And sometimes what happens in the peritoneal cavity, amount of fluid is about normally 5 to 30 ml. 5 to 30 ml. If it increases by any means, the condition is called pericardial effusion. Right. If too much of fluid is accumulated, then it is pericardium may be damaged, or heart may be damaged, outer surface. So from there, fluid will be, or blood will be entering into pericardium, and the accumulation amount of fluid will be much more. Last line. It is called tamponade. Why it happens? May occur due to bleeding. And why pericardial effusion occurs? Infection. What type of infection? What is this infection called? Pericarditis. Pericarditis. Okay. Very good. See the inner surface. This is the myocardium and this is endocardium. Thin layer of endocardium. So this endocardium is mainly made up of epithelial cell. But in between the epithelial lining and myocardium, there is a thin layer of connective tissue. First there is connective tissue, then the epithelial tissue. Together they form endocardium. Now you do one thing. Take out some portion of endocardium. Take out this layer. What is there? In this layer, epithelial tissue is there, endocardium. Now you do on the fold it like this. So this is the layer. Now you fold it like this. Now what will happen outside? What is there? Epithelial layer. Outside, inside, connective tissue. Now you think of the valves present in the heart. In the valves also, they are made up of like this. Outside is epithelial, inside there is connective tissue. Understand? Okay. Now the heart. Without fibrous pericardium. So what is the one layer of pericardium that is fixed with the myocardium? That is fixed with the myocardium. So now let me take a portion of wall of heart from here to here. What you will get? Epicardium you will get. What is epicardium? The outer serous layer. Okay, so epicardium you will get. And remember one thing, through this epicardium, just below this epicardium, the coronary arteries, it will pass through this epicardium, just over the myocardium, below the epicardium. They will run this. That's why if you go see the external structure from outside, if you study the heart from outside, you will see the vasculature. You will see the arteries. You can see these are visible. So they are actually lie in the epicardium. From epicardium, the branches will be entering into the myocardium. So suppose this is the layer of epicardium. So blood vessels will run along this epicardium and they will give out branches into myocardium. And capillary, they will produce a lot of capillaries within the muscles. Some of them will be entering here in the endocardium. Some more muscles will be entering here, more vessels, and they will be anastomosing here, joining to each other. Why? Suppose this capillary is blocked. This capillary is supplying this area. Now, if it is blocked, now this area will die. So, for its survival, what it does, another capillary is entering here. So, both of these will join. Number of capillaries join there. So that if one is blocked from other capillaries, the same area can get the blood. That's why they join together. Where? Because this layer is most prone to CVD, cardiovascular disease, blockage. That's why this area, anatomically, this area is given attention so that blood supply is not reduced in this group. Not only this, the innermost 0.1 millimeter of area, innermost 1 millimeter area, they don't need any circulation from the coronary arteries. Why? They can directly draw their oxygen and nutrients from the blood within the cavity. From there, they can absorb oxygen, they can diffuse carbon dioxide, they can absorb the nutrients, they can release their end products. And that too very small, very thin layer of 1 millimeter. Okay, so this area is very important. They are very prone to diseases, short supply of oxygen, particularly in pathologic condition. This area suffers most. Okay.
Sir, can you explain this part? I didn't understand this part.
Couldn't follow your question.
Sir, can you please explain this part? I didn't understand.
I said, there will be a full class on coronary circulation. How this coronary circulation supplies blood to the myocardium. What are the? It has two divisions, right artery, left, or artery means right coronary artery, left coronary artery. So they are supplying the whole myocardium. They are supplying the whole myocardium. So how they are supplying? While producing the branches, how the branch enters into the, and after entering, what they do? That will be explained there. Here in short I explained. What is this? So while a blood vessel is passing through the epicardium, they will send branches, capillaries, send small branches. These branches will produce capillaries. And a number of branches will be entering up to this level. So as they proceed, the diameter of this will be gradually reducing. When they will be entering in the last layer, they will anastomose. Anastomose means join to each other. Join to each other. So that if one small artery is blocked here, then this area will be suffering. So that it doesn't happen, what is, it is ending into an anastomose. Another capillary is adjoining this anastomosis. If it is blocked, then from this part, this area can get blood. Understood? Yes. That is the purpose. Because as I said, this area, why this sort of adjustment? Because this area is most prone to coronary, what is this, ischemia or myocardial infarction. So to prevent that, ultimately my body is designed in such a manner, I will try, the body will try to manage the situation. When it is beyond that limit, then we will suffer the disease. See, whenever any disease develops, it gives signals to you. Something wrong. It makes some symptoms so that I can take care of. So if in absence of any symptom, what will happen? The disease process will continue, and one time I will not realize, that time I will die. But it is giving you a signal so that you can take care of this. What it happened? Let's go to doctor. Doctor will advise. Some you undergo USG, undergo X-ray, or undergo this sort of blood tests, or undergo MRI, or go for a PET. So then to diagnose what is wrong. Once it is known, diagnosis is done, then we have treatment. If it is available, we will be treating it, we will come out of this situation. So in the heart, actually we are having three layers: the outer, external epicardium, then myocardium, then endocardium. And the myocardium is thick, and the thickness of this myocardium will vary according to the chamber. Now what determines the thickness of the myocardium? What is the factor? Factor is, hello, this chamber, atrium, how much work you do? What you have to do? Nothing. I have to pump initially I don't need to pump. When the ventricle is relaxing, will be relaxing, my blood from atrium automatically will go there. The valve will open automatically, since in the ventricle there will be negative pressure while it will be expanding. So, but pressure within the atrium is more because of the accumulated blood. So they will open the valve. So without contraction, 70% of blood will be entering into ventricle. And for the rest 30% of blood to send to the ventricle, then atrium has to contract. So only for this 30%. Okay, so that's why its wall thickness should not be like the ventricles. So its thickness is minimum. How much? 2 mm only. Okay, then not 2 mm, 2 centimeter. Okay, then what happens? Then what happens? The blood will be entering into the ventricle. Say it is the right ventricle. Say it is the right ventricle. Let's see what should be the thickness of the right ventricle. Thickness of the myocardium in the right ventricle. Okay, right ventricle, what you will do? I will send my blood to the lung. And the distance, only this much. So, since this much distance, you have to go only from here to there. So, you require only little force. Why little force? Because while traveling from here to there will be less friction, less resistance. So, no need of exerting, creating so much of pressure. So then why I should develop my musculature thick? No need. Only I have to generate 25 to 25 millimeter of mercury pressure. So for that pressure, my thickness 5 millimeter will do, 5 centimeter will do, 5 millimeter, no centimeter will do. The first one is 2 millimeter. So it will do. Okay. So thickness depends on what? How much pressure the chamber has to create to send its blood to the periphery or to যেখানে যাওয়ার ইচ্ছা তার সেখানে. So if distance is less, resistance is less, thickness will be less. If distance is more, resistance is more, then thickness will be more. So it will determine what would be the thickness of the ventricles. Now you think about the left ventricle. We learned the thickness, maximum thickness of ventricle, left ventricle is maximum, among comparatively more. How much it is?
10.
Actually, 12 or less than 12. It is the upper limit. 12 is the upper limit. When echocardiography is done, it is whether we are having hypertrophy of the heart. That is measured by the thickness of the ventricular wall. If it is more than 12 and the heart ventricle shape is cone shape, like this shape, then we call it thickness is more, shape is changed like that, then we call it hypertrophy. Again, why there is hypertrophy? Definitely resistance is more than normal. Ventricle will be sending blood to the periphery, to the systemic circulation. If the resistance in the peripheral circulation is normal, like you, then this thickness within 11, 12, 10 is okay. But if the resistance is more, then the ventricle has to create more force. For that purpose, it needs more muscle, because the force will be generated by the muscles. So there will be hypertrophy. If you do it regularly, daily, what will happen? There will be hypertrophy. Now I don't have any resistance on my head, no weight. Without weight I am doing. Another person keeping 5 kilo weight he is doing. So who is working more? Those who are having the more resistance. His hypertrophy will be more, not mine. Similarly, here also, the blood ventricle has to work against resistance. That's why it is thick. Now you think, what is hypertension? Most of the elderly people suffer hypertension. Why? Various causes. The peripheral resistance through which blood travels is more. It has increased. Why? One thing is, the blood, the outermost layer is elastic in nature. When blood enters here, the wall distends. If this elastic layer, outermost layer, loses its elasticity, becomes stiff, then it will not be expanded. As a result, what will happen? More pressure will be generated on the wall. More pressure will be generated on the wall. Okay, this is one thing. Another thing, another reason of resistance is the muscular layer of these blood vessels. They may be contracted by the neural system. They may be relaxed. When they are stimulated by the sympathetic nerve, they will contract and constrict the lumen. So, when lumen is constricted because of contraction of the smooth muscle layer, smooth muscle are circularly arranged. So, sympathetic stimulus will cause vasoconstriction. Now, lumen is narrowed. So, what will be the result? Heart will have to work more because resistance has been created. Lumen is narrowed. So, heart has to create more pressure to bypass this, to overcome this resistance. And if it is a continual process, then wall will be hypertrophied. Again, you are having lot of bhaja bhuji, fried item, oily substance, ghee, butter, everything. You are eating lot of. So what you will do? Body will do. It needs fat. But requirement is this, but you have taken this mass. So what will happen to the extra thing? This will be deposited here. And there are some adipose tissue surrounding the organs. So there it will be deposited. Then some lipids, some fats will also be deposited, will also be there within the blood. That's why we, in the laboratory, we ask for lipid profile. What is the condition of my triglyceride? Means level. What is the condition of lipids in my blood? Oh, your serum lipid is increased, triglyceride too much, more than 300 milligram percent. Cholesterol too high. Low density lipoprotein very high. It means your lipid content in the blood is high. It signifies this excess fat will be deposited within the innermost layer. What is this innermost layer? Intima. So within this intima cells, they will be deposited. This is called atherosclerosis. They will be deposited there and will cause, see, outermost layer, these are okay. Only deposition is made within the cells of the innermost layer. So innermost layer will bulge into the lumen. Will bulge and causing narrowing of the vessels. As a result, suppose this is the vessel, this area is narrowed. Atherosclerosis. When it will be completely blocked, then there is a blockage. Then this area will not be able to supply blood to the part of the body. And this part will feel low, which will not find any oxygen, so it will feel some pain, ischemic pain. Same thing, it can happen in your leg. You tie here or here. After some time you will find what? Numbness in your hand. Then we call it jin. This will happen. Tingling sensation will be there. Why this sensation? Shortage of oxygen supply to this. accumulation of metabolites. They are unable to wash away. So they will create this anginal sensation. So if it happens in your heart, it will also create pain. This sort of sensation you will feel. So it will signify there's something wrong in my coronary blood vessels. Somewhere maybe block or semi-blocks is there. So let's go, let's see by angiography whether any block is there. Yes, it is there. In LAB it is there. In right bundle, in right side of the artery it is there. Then if it is not removed, previously it was removed bypassing, taking another blood vessel from your body and bypassing this. So now it is not done. Nowadays what is done? Balloon angiography. First, so the catheter will go there, find it, then they will what? They will gradually insert this catheter through this and slowly this will enter. Okay, now it is removed. Means this will, now it is distended. Lumen is opened. If I remove this, again it will close. Again it will close. So what they do? Okay, we do one thing. In the same catheter, there is one balloon. Let's inflate it. So balloon will be inflated, blood vessel will also, lumen will also be dilated. Then remove the balloon, insert one spring. So removing this, they will insert one spring, and then the catheter spring will be there for life. This area will not be again narrowed. This is angioplasty. Balloon angio, you might have heard. So this way, this block is removed. Okay. So if you don't want this thing, so avoid having too much of fat. Okay. This excess fat, not only cardiovascular disease, it has got many other diseases. It can create many. I don't have that much time. One day when I get time, obesity, what is the complication of, so what it can do, obesity can do, I'll let you know. Now, let us discuss about the different chambers of the heart. Right atrium. Don't look at this. Tell me. Every chamber has one inlet, one outlet. What is the inlet of right atrium? It has got two inlets. One superior vena cava, one inferior vena cava. Are there any valves there? Are there any valves? At the junction of superior and inferior vena cava with atrium? No valve. For atrium, for incoming facility, no bar. You enter. I will not restrict. You enter. Always, whenever you come, you can enter. Inlet is free. Incoming is free. Like when some mobile operator, when your money is finished, but they keep it, this allow you. Okay, incoming facility is there, but outgoing facility will not be there. Recharge it, then this facility will get. So some days they are giving. So here also, incoming facility always there for atrium. Always there. Whenever you want, come, enter. But outgoing facility is not there. Always not there. Because there are some valves. They will allow, these valves allow always one-way movement. There is one-way traffic. In reverse direction you can't come. From atrium, you entered atrium, you cannot go to the veins, you have to enter within the, one way only to the ventricles. For entering from both the atrium, from entering from both the atrium into the ventricle, there are orifice. The connection between atrium and ventricle, there is an orifice. Orifice means one aperture, and within this orifice there is a valve. In the left atrium also there is a valve. These are outgoing valve, outgoing from atrium to ventricle, and these valves are called, since they are present in between atrium and ventricle, so they are called atrioventricular ventricles. So they have got other name. AV valves have other name. Since one is named tricuspid, another is named bicuspid. Okay? The right atrium, the opening of right atrium to right ventricle, in the opening, there is, in the orifice, there is a valve, and this valve is tricuspid. Tricuspid valve. Okay, tricuspid. Okay, I'll discuss in detail the valves. So this is tricuspid, and for left atrium, it is bicuspid. Another name is there, mitral valve. In echocardiography report, they will not say, it will not be mentioned tricuspid or bicuspid. They will mention what? Mitral valve. Most of the problem lies in mitral valve. These valves have various problems. We will see what are the problems. Some common problems I will discuss. So, atrium to ventricle, there is one opening. Atrium to ventricle, there is one opening, orifice, and this orifice is, in the orifice there is one valve. These valves are round. Valves are round, connected to a ring, fibrous ring. These are, in the orifice, there is a fibrous ring. From the ring, suppose this is the ring, then tricuspid. So one cusp, this is one cusp, this is another cusp, there is another. So they will come out, they will come out. Okay. Now this cusp, like our tongue. You think about tongue, it is a little curved. So this is the cusp. Three cusp is coming. And when all the cusps close, you will not find any gap. You will not find any gap. And interestingly, what you will find, from the bottom surface of this cusp, there are some threads, particularly from the periphery, margin of the cusp, some threads are coming out. These are chordae tendineae. These are chordae tendineae. Now, this chordae tendineae remains attached to a particular type of muscle. That is, what muscle? Papillary muscle. They are outgrowth of muscle. What muscle? Cardiac muscle, from the ventricular inner wall. So from the ventricular inner wall, this outgrowth is there. From the outgrowth, this thread is there. This thread is joining the leaflet along its periphery, and some fibers will be attached to the bottom surface. Why there? What is their importance? So suppose these are the leaflets. This is one leaflet, this is one leaflet. What is their tendon? Cardiac tendon. And these are muscles. So when the ventricles will be contracting, because of the pressure, they will be going up, and within the atrium they can open. As a result, what can happen? The blood that has entered within the ventricle, again it will be go back. There will be regurgitation, but we don't want regurgitation. What to be done? I will not allow re-entry into the aorta. So how it can be done? So when it is trying to open, okay, not this, not more than this, the threads are there. The threads they will prevent bulging, ballooning. This is called ballooning or bulging. So their function is to prevention of bulging, because if it is bulged, then there will be gap, incomplete closure, so blood can from ventricle can come into the atria. So let us talk about this chamber. What is this chamber? Right atrium. It receives blood from, as we see, and superior vena cava and inferior IVC. So they are draining blood into the right atrium. Okay, and they are waiting. Suppose my ventricle is at that time when the auricular artery is filling with blood, that time my ventricle is closed, is contracted. By this time it has stored enough blood. Auricle has stored enough blood. Now my ventricle will be opening. Here opening, here vacuum will be there, negative pressure will be created. But comparatively here the pressure is more. So automatically valve will open. Valve will open like this. So blood will enter. 70% of the blood that is contained in the atrium will enter into the ventricle passively. Ventricle has no, auricle has not contracted. Only just it is opened. And since in the ventricle pressure is less, so it is entering passively. Now 70% has entered. Even thereafter, certain 30% retained. And what to do? That for that 30%, now the auricle will be contracting. Then rest of the 30% will enter into the ventricle. Now ventricle is full. Now the ventricle is full. So since ventricle is full, now ventricle will try to contract. So it will create pressure within the cavity. Blood pressure will be increased within the ventricular cavity. So blood will try to go back into the atrium. So what will happen? It will push the valves. Now the valves will become closed. So it will make a sound, fast heart sound. Both the bicuspid valve as well as tricuspid valve, they will be closing. When they will be closing? When ventricle is relaxing. So beginning, you will hear first sound, heart sound when the ventricle starts relaxing. If it is not closed, then blood at the time of contracting, blood has already entered. Now ventricle will be contracting. So pressure within the ventricle will be rising. So it will try to again go to auricle. So first close this door. There is sudden closure of this. It will make the first heart sound. So only one outlet is left. That is the aortic. It can go to aorta or to the pulmonary through the pulmonary artery. There are also valves, semilunar valves. Now pressure within the ventricle is rising because of contraction. Now those two valves will be opened. So blood from ventricle, from right ventricle will go to lung, and from left ventricle it will be circulated throughout the body. Okay. And again the heart will relax. Contraction finished, heart will relax. So again the blood already entered into those two vessels, aorta and pulmonary artery. They will try to come back. So they will try to enter, and this pushing of blood, they will cause closure of the semilunar valves, and they will create another sound, second heart. Where it is located? Where we will find this blood? What is this? Atrium. Which atrium? Okay. And below this, what is this? Left ventricle. Okay. Now this is closed. The mitral valve is closed. Now what is the condition of the ventricle? Whether it is relaxing or it is contracting. It is contracting. It is contracting. It is contracting within the ventricle. Pressure is increased and that has closed this. Otherwise, what would happen? So now, it will cause opening of this valve. When the pressure is within the ventricle too much, it will cause opening of this. So these cups will open, these cups will open, these cups will open. So blood will enter into the aorta. Same thing will happen there. It is the right atrium. Since it is closed, it means from right ventricle, blood is going through this. It is closed. Otherwise, the blood would be coming to the left atrium. Trabeculae carni. What is this? These are also muscles. These are also muscles. This is what? Capillary muscles. So these are accessory to this. When they contract, they will also be contracting. These muscles will be contracting. And passively, their contraction passively will help them. Help the papillary muscle to contract. It will strengthen the force, the activity of the papillary muscles. That is the function of the trabeculae carni. These are chordal tendini, papillary muscle. It may cause disease, it may cause disease. This may cause disease. Chordal tendini ছিঁড়ে যেতে পারে, can be torn. Then what will happen? They will not be, they will bulge. When ventricle will be contracting, they will be bulging and there will be regurgitation of blood into atria. There may be, this is okay, but this may be paralyzed. These muscles can be paralyzed, may become paralyzed. Now what will happen? Same thing. There will be bulging. There is nobody to contract the chordal tendini. There may be bulging. So when there is bulging, closing will not be proper. There will be some gap. So blood will be coming back to atria and this is called regurgitation and you can hear it using your stethoscope. Murmur. Again, problem may be here in the leaflets, in the cusps. What? There may be deposition of calcium. There may be deposition of calcium. So because of deposition of calcium within the cusp will become shortened and there will be weight, increase in weight. As a result, suppose this cusp is okay, this cusp is shortened and heavier. So as a result, there will not be proper closing, proper opening. So there will be regurgitation. And this is called sclerosis. This it can happen in any valve. If it is happening in aortic valve, aortic sclerosis. It may happen in pulmonic valve. In any valve it can happen. Particularly those who are suffering from arthritis, rheumatoid arthritis. So there is a chance of developing sclerotic heart disease. Means there will be sclerosis there of the valves. So whenever somebody is suffering, so immediate precaution has to be taken. This, you know this, how blood is circulated? The more clear view. Okay. When it is pumped, where it will go? Into this or into this? This is contracting. Where it will go? Into this or into this? Whose ventricle it is? Right ventricle. So it will deliver its blood to this. One is going to one lung, another is going to another. When this will be contracted, blood will enter into this. This is the aorta. This is the chorda tendini, papillary muscle. This is the cusp. Okay. When see the closing condition and opening. This is opened semilunar valve and this is closed semilunar valve. And what is this valve? No, this one. What is this blood vessel? This is aorta. This is aortic valve. Okay, just close to this, there will be aorta. This is the superior view of the heart, and this is the pulmonary valve, pulmonary artery. These two are outlet of the two ventricles. So it is the outlet of the left ventricle, it is the outlet of the right ventricle. Always try to remember. Second heart sound is caused by closure of aortic valve and pulmonary valve. And first heart sound? Tell me, first heart sound? You. What is the cause of first heart sound? My good, there should not be any confusion. It should be like this. What is the second alphabet in English? B, like that. What is the first heart sound? What is the cause of first heart sound? You have to remember like that for the lifetime. There should not be any doubt. Because you will be hearing, using stethoscope, first sound, stethoscope. So, first heart sound means, this is a closing or opening. This is a closing. Can anybody tell what is the cause of third heart sound? Are there any sound like that, fourth heart sound or third and fourth heart sound? AV valves opened. So 70% of blood will be entering into the ventricle. While entering at the very first moment, lot of blood will be entering, and this rapid entry of blood, they will vibrate the blood, vibrate the IBS. IBS means intraventricular septum. The septum, there will be vibration. And this vibration will create a sound. This sound is third heart sound. Okay? So third heart sound is, reason is what? It happens during diastole. Diastole of the heart. Diastole, entry of epivalves, or opening of epivalves, rapid entry of blood from atrium into the ventricle, and they will cause vibration within the blood and the interventricular septum, and they will create the sound. And this is the third heart sound. Again, rest of the 30%, when auricle will be contracting, rest 30% will be entering again with some force. That will also create a feeble heart sound, feeble sound. This sound is called fourth heart sound. Now it is clear to you what are the causes of this fourth heart sound? Okay, after this, next, my class will be on another constituent. একটা এখনো আমরা বলিনি, another constituent of the heart. Two more constituents left, we didn't discuss. One constituent is coronary circulation. The blood vessels are within the heart. Did we discuss? So that are also constituent of the heart. You will find them within the heart. So that has to be discussed, learned. Another constituent, our heart is having a generator, powerhouse, isn't it? Our heart is having a powerhouse, generator, it is creating. And you can, generator means it is creating some current. You can pick up this current. You can pick up. How you can pick up this current?
By that meter.
If you place one electrode here and another here and connect to a galvanometer, you will find some potential difference. Why? Definitely, there is voltage difference across my two hands, or here to here, or here to here. Otherwise, why this voltage different? Some current is generating is within my body. And you can pick up this current using an equipment called electrocardiogram. Gram, question comes. What do you mean by electrocardiograph and electrocardiogram? Okay, let's see. Whether you are correct or not, tomorrow you tell me. Okay. So that means we have a generator, producer of current. Now where it is located? In the heart. It is located in the heart. In the heart where? In the right atrium. In the right atrium where? In the posterior. In the posterior, lot of area is there. Where? At the junction of the superior vena cava and atrium. In the posterior wall, there is a small area, 12 millimeter by 2 millimeter by 1 millimeter. There is a small area, crescent shaped area. These are having special type of cells. These cells are called P cells, pacemaker cells. And one of the unique thing is these cells, P cells, also called pacemaker cells. These cells can generate their own impulse rhythmically, not continuously, but rhythmically it produces current, stop, current, stop, current, stop. Switch on, switch off, switch on, switch off. Okay? So rhythmic production of current. And according to the rhythm according to the number of current impulses, this current means cardiac impulses, number of current it produces in 1 minute, that determines the my heartbeat. According to the number of current, number of impulses produced in this area is called SA node, sinoatrial node, SA node. And it is the pacemaker area. This is having the pacemaker cells. These cells are highly loaded with glycogen, mitochondria, because it has to produce no current. That's why a lot of energy is needed. And cardiac muscle use mostly 70% energy comes from fat. They utilize fat as energy source. So they produce this current. With this impulse, cardiac impulse, without this impulse, heart muscle cells cannot contract. So, to every cell, this current has to go. How they will go? Main switch is there. Through that main switch, there is wiring. Through this wiring, current is coming to the fan, coming to the light, to these projectors. Okay? Similarly, our muscles, cardiac muscles, they must get cardiac impulse. How will they? Here they are getting through the wires. Fortunately, our heart is also having wire. This kind of wiring we are also having. Means we are also having conduction system. One producer is there, current producer, and that current has to be sent to different part of the heart. And this is done by different conducting system. We learn this. Because if I cut this line, this will become off. If one of the conduction line is cut or damaged, no impulse will be coming to a particular area, so that muscle will not be contracting. What will happen? My heart muscle will not be contracting. So again there may be problem. We have heard some disease like RBBBB, LBBB, right bundle branch block, left bundle branch block, AV block, means SA node to AV node, there is blockage. No impulse can come to AV node. Bundle branch block or bifascicular block means that conduction system is not working. As a result, that area, the where that is supplying a particular area, that area will not get stimulation, they will not be contracting. So there may be problem. So we learn this. So two important aspects. One is coronary circulation and another is conduction system. Another thing important for exam also, pacemaker potential. How this potential is generated, how this cardiac impulse is generated. We are telling that they are self-generating. The heart can produce its own impulse. How? How it produces the action potential? That we will learn. Very interesting, that part.